Aches and pains, of course, we get them as we get older. One of the most popular areas that people have troubles with as they age is the hips. Joining me this morning for Healthy Living House Calls, Dr. Juan Agudelo, an orthopedic surgeon with Florida Hospital. Doctor, good to see you. Appreciate you coming in today.
John, thank you for having me.
It's interesting, though. We always hear about broken hips, things like that. Why do the hips become so vulnerable as we get older?
One of the problems is that it's a very delicate joint. It's a ball and socket joint, and it's covered by a lining that is low friction. It's called the cartilage, and we get the cartilage that we are born with. The body doesn't grow any more cartilage back, so we have to be really careful and take very good care of our joints as we age, especially the hips.
And the treatments for this have changed dramatically over the past few years. What are you guys doing now to get people back on their feet?
Well, the first line of treatment is always what we call conservative treatment. It's going to be rest, activity modification, medications for pain, inflammation, physical therapy, that it's going to be concentrated on stretching and strengthening of the gluteus muscles. Then if that doesn't work, then we have the second line of treatment, injections, which can be steroid injections or different kind of substances, natural substances that we're doing more research on. If nothing else works, then we start talking about surgery, and we have minimal invasive surgeries like hip arthroscopy. If that doesn't work, then we start thinking about doing a hip replacement, but that's the last way of treating hips.
What's the downtime? Hip replacement's a long process, isn't it?
We came a long way. So it used to be 6 months, but now we get the patients up and walking right away after surgery. The patients are walking in 2 or 3 hours. They go home the next day or in 2 days. They don't have any restrictions. They can be walking and doing the regular activities in no time with less pain as well.
That's pretty amazing. That's dramatically shrinking the downtime. Yeah, 6 months changes everything. Okay, let's talk about how you know when you're about at that point. I assume it's just normal hip pain, but a lot of times you hear people who say they broke their hip, had no idea. How can it go that far without you really knowing that something's wrong?
The reality is that if you have hip pain that is lasting more than 2 weeks, you have to be concerned, and you have to go and talk to your physician or orthopedic surgeon.
Shooting type of pain, or is this just a constant pain?
So it's more like a dull, aching, throwing pain that it's located in the groin region, because sometimes the pain can be what we call refer pain, which can be a pinched nerve, or can be the soft tissues that surround the hip, like sprains, strains. But the dual ache that it's activity related, lasting more than 2 weeks, needs attention.
Are there any other alternatives that are less invasive, or is it, when you're there, you got to get the replacement?
No, we have learned a lot during the last few years. We're doing a lot of hip arthroscopy, which can help restore the function of the joint without replacing the joint. It's done minimally invasive through 2 small incisions. We can take care of the soft tissues, inflammation, sometimes do some work with the cartilage. The patient goes home the same day with obviously less pain and less downtime.
So there are some options out there. Great. And Dr. Juan Agudelo is going to be doing a web chat today. It's our Healthy Living House Calls. You can call him from your house, kind of. Just go to our website, myfoxorlando.com, and you can do the web chat from right there. You got an orthopedic surgeon on your call right now. Doc, good to see you.
Thank you, John.
We'll talk to you in just a little bit.
Aches and pains come as we age. We know that. One of the most popular areas, or unfortunately areas, that we have difficulty with as we age are our hips. You've been submitting your questions to orthopedic surgeon Juan Agudelo, and he's joining us live right now from the newsroom with some of the questions that you've been asking. Good morning, Doc. Good to see you again.
Good morning. Thank you for having me again.
So what's the biggest message that you want people to get out of this hip pain issue?
Well, there were a lot of questions regarding surgical treatment options, joint replacement of the hip, and the time to return to work. So we're doing a new surgical technique that is called the anterior hip replacements. There's almost no downtime. The patients are walking right away. They recover faster. They go back to work between 2 and 6 weeks, depending on the type of work and the physical demands. There's less pain, less scar, and less functional limitations. And the hip replacements today are lasting 25, 30 years, which is one of the main questions that I got today.
You know, a lot of people ask too about if you have to have a knee replacement, a hip replacement, or you have to have both. Should you do them at the same time, or should you do one at a time? What is your philosophy on that?
Big replacement, it's a big surgery. So the order that I do things in the case that the patient needs both hip and knee replaced, we recommend doing the knee first because there's actually more involved physical therapy and recovery time with knee replacements. With hip replacements, they recover way faster with less pain. I don't recommend doing both surgeries at the same time because of the involvement of the physical therapy for both are completely different.
Gotcha. Dr. Agudelo, it certainly is a subject that a lot of people have questions about. We appreciate your time this morning. Thank you so much for coming in.
Thank you for having me.